Welcome, and thank you for choosing AliMed as your partner in patient safety. This demonstration features our easy-to-use hook and loop and buckled seatbelt alarm systems. We'll explain how these simple solutions can help you offer the best in patient care. These are just two of the many high-quality patient alarm systems offered by AliMed. For additional information on products, please go to alimed.com.
Hello, I'm Heidi Young, a member of AliMed's customer outreach team. And as a member of that team, I visit many healthcare facilities, and we really listen to what you have to say. AliMed wants to make your job easier, safer, and more effective. This is why we developed the hook and loop and buckled seatbelt alarm systems, two innovative approaches for alerting caregivers to potential fall situations. In just a few minutes, we'll show you how these seatbelt systems work, the different types of seatbelts, and how to use them. The seatbelt alarm system works by sounding an alarm as a patient attempts to rise from a chair. When the seatbelt, fastened around the patient, is unbuckled or unfastened, an alert is immediately triggered. The seatbelt is easy to release and is not considered a restraint, yet it keeps the patient safely in the chair and slows their attempt to rise, giving the caregiver even more time to respond and prevent a potential fall. It also reminds the patient to remain seated. There are two types of seatbelts to choose from, the hook and loop fastener and the buckled seatbelt. You can choose the one that best fits your need. The hook and loop fastener is best for long-term care because it doesn't act as a restraint, which is very important in the event of an emergency. The buckled seatbelt uses a car seatbelt type buckle. It is ideal when extra security is needed. It's especially effective for patients with limited dexterity and those who need to be stabilized for a short period of time, such as after surgery. Hook and loop fastened belts come in two options. The easy release seatbelt is for less active or sedentary patients, those not as likely to rise from their chairs, and the early warning easy release seatbelt for the more active patient. Once the hook and loop is disengaged and the alarm sounds, the patient still has an additional 12 inches of hook and loop fastening strip to undo. This reminds the patient to remain seated and at the same time gives the caregiver additional time to respond to the patient before they have the chance to completely undo the seatbelt. Now that you're a little more familiar with these seatbelt systems, let's see how to set up and use these devices. These seatbelt systems may be used with a number of alarm units, but for the purpose of this demonstration, we'll use AliMed's TR2 alarm. For more information on the TR2 alarm, see the informational video at alimed.com, keyword AliMed TR2 alarm. Seatbelt alarms can be used in a number of settings, including wheelchair, jerry chair, and side chair. In this demonstration, we'll show you three ways to attach the seatbelts to a wheelchair. Both buckled and easy release seatbelts are attached in the same way. Begin by positioning the alarm unit on the back of the wheelchair. Then position the seatbelt so the alarm cord easily extends from beneath the chair up to the alarm unit. Now attach the seatbelt to the wheelchair. One way is to bolt it on. Remove the two lower screws on both sides of the back of the chair, pass the belt between the seat posts and armrests. Reinsert the screws through the grommets into the back of the wheelchair. Another way is to use the provided plastic cable ties. Insert the ties through the grommets on the belt and wrap them around the chair posts. A third alternative is to use the Uniloop attachments sold separately. They allow caregivers to attach either the seatbelt system to a wheelchair in less than 3 minutes. Simply wrap the loop around the wheelchair back's upright tubing. The grommeted seatbelt attaches to the loop with the provided clip. Note, to accommodate larger patients, a bariatric extender can be added on to any of the 3 seatbelts to increase the belt's length. Now with the seatbelt and alarm securely attached, seat your patient or resident in the chair and fasten the seatbelt. Adjust the belt so it fits snugly but is not uncomfortable. Now on the alarm unit, select the tone you prefer, and when the patient releases the seatbelts to leave the chair, the alarm is triggered, sounding an alarm continuously until the belt is buckled or the alarm is reset. For the easy release seatbelt system, be sure the tab and slot align. With the patient in the chair, adjust the belt length and fasten the tab into the slot. With the easy release seatbelt, it is not necessary for the belt to be tight. Allow plenty of room for patient comfort. For very small patients, the plastic ties may need to be fastened further down the wheelchair frame. In order to rise from the chair, the patient will have to first unfasten the first part of the hook and loop belt, remove the tab from the slot, immediately sounding the alarm, and then unfasten the remaining hook and loop. The early warning easy release seatbelt is equipped with an additional 12 inches of hook and loop strap, allowing extra time for the caregiver to respond to the patient attempting to rise. Always be sure to test any alarm system before use to ensure proper function. Also, be sure that the belt is properly and securely fastened to the wheelchair. An improperly mounted seatbelt is unsafe for use. You've just seen how to use Alimed's buckled and easy release seatbelts. Remember, these seatbelt systems are great for alerting caregivers even sooner to patients who are at risk of rising or falling from their chair. They are easy to release and they are not considered a restraint, provided the patient can release them in an emergency. However, they do slow a patient's attempt to rise while unattended. Also remember, the buckled seatbelt is best for patients who need extra support to reduce the risk of sliding or slumping forward and off the chair, while the hook and loop belt is always best for long-term care. I'm Heidi Young for Alimed. Thank you for viewing.
For more information and to order any of Alimed's seatbelt alarm systems, go to alimed.com and click on Chair Alarms. Alimed is home to over 70,000 products, including our entire line of patient safety products.